Healthcare systems across the country are increasingly look to incorporate housing into their development plans. Whether it's building new housing on campus or partnering with local developers, we're seeing this trend really kick off across the country. Here today with me is Tim Henkel, Principal and Senior Vice President at Penrose, to talk more about this trend and how it's on the rise. Thanks so much for being with me today.
Thanks, Rebecca. Excited about this topic.
So first, give us a little bit of background. When did you first start to see this trend?
Well, I think we started hearing a conversation about the determinants of health, where the healthcare industry started to think about beyond their delivery of health services, the delivery of healthy environments, social networks, and just the physical places that people were living and how those were affecting the well-being of the patients that they saw, whether they're a hospital or an insurer or a broader healthcare system.
So the data is one thing, but then when did you start to realize this was going to have a business impact as well?
Well, I think we started to partner with nonprofits who were providing services to our residents, sometimes because of what the residents' needs were, and sometimes because we had engaged them early in our development process. And then it became a necessity. These were the services that our residents required, and then the proximity of those services became important. So as time wore on, we realized that siting developments near hospitals, near healthcare institutions, near urgent care facilities, and in places where healthcare was more accessible, that became a location benefit and advantage.
So the proximity is really a major portion of why it's so beneficial. How can local developers like Penrose help support hospitals in this endeavor?
Well, hospitals in particular, as part of the healthcare systems, are pretty static. They don't move. You can't pick them up and move them around. And so we find that they're looking for ways to improve that environment, to make it easier for someone to get to the hospital or make it a better decision to come to the hospital where it is. So improving the environment around the hospital, doing redevelopment, improving the neighborhoods, becoming more of a corporate citizen in the very local community. So we're working on a project in Findlay, Ohio, with the Blanchard Valley healthcare system. That healthcare system is definitely one that is recognizing both that they have real estate that is available to use for a housing purpose, that is not necessary for their hospital needs, and also an underhoused working population. So in different settings, different healthcare institutions and hospitals are finding it really valuable to create housing opportunities where their workforce can come. Whether it's to provide them with an affordable option or even to gain that proximity of a workforce. One of the things that we've heard hospitals express is a concern about in a dire emergency, in a time of a natural disaster or something like that, their workforce may be actually far away. Those emergency responders will be in completely different places and unable to get to the place where they really need to be.
So when you're engaging in a partnership like this, who is your counterpart on the hospital side?
That's a really important question, and it's important because for a long time, the counterpart on the other side of the table with the healthcare institution was not somebody who spoke a housing language, no more than I speak a healthcare language. And what we're finding is the healthcare institutions, the hospitals, are investing in people with housing backgrounds, not necessarily developers themselves, but people who understand the delivery of housing units. And that investment is creating that intersection, that translation between the two languages that housing professionals and healthcare professionals speak a little bit differently, and that coming together is becoming really valuable. And so that's the exciting soup right now, the recipe of housing professionals and healthcare professionals getting in the same room, innovating together, brainstorming together, and trying to find that maximum benefit, which is, again, something that I think is probably more than we even guess right now.
In hearing you talk about this, it really sounds like affordable housing in particular and healthcare as a natural partnership. Well, thank you so much. This is really exciting. Thank you for being with me today. If you'd like more information about Penrose or their portfolio, please visit www.penrose.com.